Imagine you were playing Operation, the challenging children's surgical game designed to test hand-eye coordination and fine motor skills. Do you feel the sense of urgency required to successfully remove each piece? Now imagine you are told to play the game with your eyes closed. Seems pretty impossible, right? Currently, the thoracostomy procedure is similar to just that. This life-saving procedure is typically performed to drain unwanted air, fluid, or blood from the space around the lungs. Physicians are tasked with blindly inserting a chest tube into a patient with only haptic feedback and physical resistance to go off of, while they are advancing the tube from the initial incision into the pleural space. Due to the lack of visual aid or assisting tools, complication rates are as high as 40%, with many resulting in malpositioning of the tube or accidental organ puncturing. There are over 100,000 thoracostomy procedures performed per year in the United States in a trauma setting. This is roughly equivalent to $1.5 million per year spent on chest tube insertion kits, demonstrating a strong clinical need for improvement.
In order to solve this issue, we have designed a guide tool to aid in chest tube insertion. Named PleuraGlow, our device is a wide tube that will be inserted into the body before the actual chest tube. In the current procedure workflow, the physician first makes an incision between the ribs and uses a Kelly clamp to create a tunnel from that incision into the pleural space. Following this, they insert a finger into the tunnel to feel if the pleural space has been punctured and is ready for tube insertion. Our device will seamlessly integrate into this step. Along with their finger, the physician will insert PleuraGlow into the tunnel passage. Once PleuraGlow is in place, the physician will be able to remove their finger and the tunnel to the pleural cavity will remain open. Attached lights will allow for the physician to visually confirm the tube is in the proper position. The chest tube is then able to be inserted through PleuraGlow. Once the chest tube is in place, PleuraGlow can be removed and fluid draining can commence.
The current standard of care is a blind procedure lacking the proper resources needed to confidently and accurately insert a chest tube. With a high number of procedures performed and facing complications per year in the United States, our device addresses the user needs by providing a way for them to visualize the body cavity, resulting in a reduced number of procedural complications. To assemble our prototype, we began with thorough testing to achieve two goals: ensure a lighting system provided tangible improvement to visibility within the pleural space, and confirm the material utilized in the design introduced no new risks due to abrasiveness or puncturing. This is accomplished through luminosity testing to evaluate the efficacy of our lumen output and light source placement, as well as material compressibility tests to ensure the device meets flexibility requirements.
Our solution improves upon the current standard of care by incorporating a lighting system that provides visibility for the physician when maneuvering the chest tube inside the body. Our guide also holds the tunnel space created by the physician open when the finger is removed to advance the tube into the pleural space. There is currently no solution on the market which addresses this obstacle, and our users frequently complained of having to re-tunnel before inserting the tube because they were unable to find the original channel from the incision to the pleural cavity. Our design appeals to stakeholders because it adds marginal time and cost to the procedure while greatly improving user experience and accuracy. It's also simple and easy to use, meaning that it can be implemented into the current workflow with little to no additional training.
To bring our device to market, we need to continue with rigorous material testing in order to manufacture our device to be one piece instead of multiple pieces adhered together. Because our device will be a Class 2 medical device, we'll need to file a 501(k) pre-market approval with the FDA before we bring our novel guidance device to market.